The region of the Americas was the first in the world to eliminate the endemic transmission of measles in 2002 and rubella and congenital rubella syndrome, or CRS, in 2009. Rubella is a disease that can cause multiple birth defects, including deafness, blindness, and severe cardiac defects, as well as miscarriage and stillbirth if a pregnant woman contracts it. On April 23, 2015, the International Expert Committee convened by the Pan American Health Organization, or PAHO, confirmed the elimination of rubella and CRS after a rigorous review of the evidence presented by all the countries of the region. So, how did we achieve this? Here are the 10 key actions taken by the Ministries of Health in the Americas and PAHO that were essential to the success of rubella elimination efforts. 1. A high level of political and financial commitment was achieved. In 2003, the Ministers of Health of the Americas made the commitment to eliminate rubella and CRS from the region by 2010, after having achieved measles elimination in 2002. This commitment was widely shared from the highest national political level to the local community level, which helped guarantee that PAHO's recommended elimination strategies were successfully implemented. Rubella and congenital rubella syndrome elimination were achieved in 2009, when the last endemic cases were reported in Argentina and Brazil, respectively. The rubella elimination was an example of joint commitment to child and family immunization and showcases how Pan-Americanism is a decisive factor in achieving important public health milestones. 2. Strategic partnerships were created. Strong and strategic partnerships with scientific societies, academic institutions, and churches were cultivated and sustained at the country level. Collaboration with the news media not only increased visibility for the Rubella Initiative, but also for routine immunization programs. PAHO also promoted the development of key partnerships to support the Elimination Initiative, which included the American Red Cross, the U.S. CDC, the Canadian International Development Agency, the Measles Rubella Initiative, Gavi, the United Nations Foundation, the Japanese International Cooperation Agency, the March of Dimes, the Sabin Vaccine Institute, UNICEF, the United States Agency for International Development, and the Church of Jesus Christ of Latter-day Saints. 3. The rubella vaccine was introduced. Starting in the 1990s, the measles, mumps, rubella vaccine was introduced free of charge into national immunization schedules. This vaccine marked a historic milestone in rubella and CRS elimination by ensuring that all newborn cohorts would be immunized against these diseases. The first dose of this safe and reliable vaccine is applied at 12 months of age, and the second at 18 months or 4 years. Vaccination coverage equal to or greater than 95% is recommended in every municipality of every country in the Americas as an essential strategy for keeping the region free of measles, rubella, and CRS. 4. Indiscriminate mass vaccination campaigns were carried out. Between 1998 and 2008, more than 250 million adolescents and adults in 32 countries and territories were vaccinated against measles and rubella as part of mass vaccination campaigns. In addition to vaccinating in health centers and door-to-door vaccination, health workers took the vaccines to non-traditional places. Vaccination posts were set up in schools, universities, prisons, subway and bus stations, workplaces, stores, fairs, markets, shopping centers, parks, stadiums, concert venues, and beaches. 5. The regular immunization programs were strengthened to reach all corners of the hemisphere. By vehicle or donkey, on foot or on horseback, by boat or raft, health workers were committed to reaching the most neglected populations with vaccination. They traveled the border areas between countries, made their way to remote geographical zones and unsafe urban areas, such as favelas and other slums, and reached families in indigenous and Afro-descendant communities. 6. Bold social communication strategies contributed to rubella and CRS elimination. Innovative communication strategies have been used for mass rubella vaccination campaigns, which target men and women of different age groups that have not traditionally been the focus of national immunization programs. This helped ensure high vaccination coverage through the countries of the region. These tactics have harnessed the inestimable support of sports leaders, in particular soccer players, to represent the face of vaccination campaigns in their respective countries, capitalizing on the popularity and reach of the sport to encourage male participation in vaccination activities. Non-traditional methods were also implemented, such as the use of megaphones for promotion or enlisting the help of churches at the regional and local level to generate demand for vaccination activities and facilitate the work of vaccine brigades, particularly in rural or isolated areas. 7. Rubella and measles surveillance were integrated and CRS surveillance systems were set up. Since the signs and symptoms of rubella are similar to measles, in mid-1998, countries began to integrate rubella and measles surveillance for case detection and timely confirmation. Gradual strengthening of surveillance systems made it possible to conduct immediate case-by-case investigation, rapidly implement response measures, and improve the clinical monitoring and management of affected children. In addition, countries set up a system to monitor congenital rubella syndrome for the timely notification of suspected cases, mainly at the first level of care. While only 13% of the countries in the Americas reported CRS cases in 1998, that figure rose to 100% in 2003. 8. PAHO's revolving fund has facilitated the timely supply of measles rubella-containing vaccine for 41 countries. The PAHO revolving fund is the regional mechanism that facilitates timely access to high-quality vaccines at the lowest prices for the majority of countries and territories in the Americas. Taking advantage of economies of scale, the revolving fund pools national resources and procures 46 vaccine presentations and 29 immunization supplies on behalf of 41 participating countries and territories. To this end, the revolving fund has played an important role in making the countries of the Americas free of rubella and CRS. 9. Laboratory capacities were strengthened. As countries moved forward in their efforts to eliminate rubella and CRS, it became essential to document the endemic genotype to determine the origin of cases. The ability of labs to confirm or rule out suspected rubella cases with the same serologic test used for measles was also strengthened. The countries now have greater ability to carry out more specific diagnostic tests, such as viral isolation and genotyping, for final classification of cases imported from other regions of the world. 10. A maximum alert level is maintained vis-a-vis imported cases. Measles and rubella viruses are still circulating in other regions of the world, which means the countries of the Americas are at risk of virus importations, which can happen when travelers bring the measles or rubella virus to our region. To this end, the first outbreak in the post-elimination era with more than 12 months of transmission occurred in the northern states of Pernambuco and Ceará, Brazil. By definition, Brazil had re-established endemic measles transmission. After intensive surveillance and vaccination efforts in the state of Ceará, the outbreak was finally interrupted. The last confirmed case was reported on July 6, 2015. Therefore, countries should remain vigilant and not let their guard down, maintaining high and homogeneous vaccination coverage, as well as a sensitive, high-quality surveillance system to facilitate a rapid and effective response to imported virus remain essential for the Americas to sustain the gains we've made in elimination. Above all, health workers should maintain a positive attitude and a permanent commitment to maintaining the achievements in elimination. The countries of the Americas will submit lines of evidence that support the sustainability of measles elimination in their territories to the International Expert Committee. The IEC will then analyze and discuss the evidence in order to assess the feasibility of declaring the Americas free of measles in September 2016. Any measles vaccination campaign that does not include the rubella vaccine is a missed opportunity. The experience of the Americas in rubella elimination has demonstrated that we can conquer a disease if we work together, recognizing the strength of teamwork and embracing the richness of diversity among people and communities. Rubella elimination was achieved based on the principles of commitment, equity, solidarity, and Pan-Americanism, along with the brave spirit and unrelenting efforts of health workers and volunteers.